Okay, up next is my personal favourite, it's using the Compex on the quads. This has huge range of applications for anyone post-surgery or someone's had a major knee problem. Often when you've had surgery you can't weight bear through your legs, so you lose your quads very fast. Often post-injury your knee's very swollen and the swelling itself causes a lot of muscle wastage. So there's a lot of applications for using the Compex on the quadriceps for rehabilitating a knee injury. Okay, next exercise I'm going to show is how to use the Compex for activation of the quad muscles. So this is ideal for anyone who's had knee surgery, where they're going to lose quad size pretty quickly after surgery. Anyone who has some manner of knee injury where they do need some better quads activation. What we're going to focus on here with Simon is in particular his medial quad muscle, which is the vastus medialis, and in particular we want to focus on these fibres here called the VMO. So if Simon just loads up his quad, we can see this big teardrop muscle here. This one we will focus on. The other quad muscles around here will also give you knee support, but this muscle in particular will give the patella or the kneecap a lot of support. So what we have here is I've placed some electrodes on the VMO, on the inside quad and on the outside quad. So I'm going to get Simon to do a squat movement, so he's going to descend into a squat and then hold them back up again. Now the purpose of this band here is that Simon thinks about pushing his knees out against the band to make sure his kneecaps stay in line with his feet. Okay? Otherwise he may collapse inwards, which is what I don't want. Okay, so we'll start the Compex, and as he feels the contraction come on, he will descend, hold it and then ascend. So what I'm doing next with Simon is I've chosen just a single leg squat using suspension as his counterbalance. I could choose a whole bunch of different exercises for this. I've just chosen this one as a end stage or late stage quads rehab exercise. He's now onto one leg, so onto 1 foot, so it's full weight bearing on the single leg. He's working again with the Compex, so as it contracts he will come down, he'll hold, he'll come up again. So again the Compex will augment his own quads contraction through the range of movement. So this is again fantastic for any late stage post-op knee injury. So post-op ACL, post-op meniscus repair, all those type of injuries. The reason why I put Simon onto a slant board is it keeps his ankle in some slight plantar flexion. That takes away his calf muscle, in particular his soleus, so that can't stop his shin going forward. So now all the load goes onto his quads and onto his knee.